So my name's Hannah. I'm just the chair for this session. I work for the Health Promotion Agency, which is a national-based organisation, but we're based in Wellington. So this afternoon I have the privilege of introducing our first workshop sessions, and so I'll firstly introduce Tai. So Tai Kake is with the Ministry of Health, and he has quite a background in, I don't know whether any of you would have had the chance to look at your tablet if you managed to make it work. Tai has a background in addiction and mental health research, so he comes to us with a lot of expertise, but he's also a real pleasure to work with, I have to say, personally. And Terry is from KPMG. Terry's been working on the outcome measures work probably for about 18 months. So some real knowledge here, and they're going to share that with you this afternoon. The title of their presentation is Enabling Gambling While Minimising Harm, and how can government measure outcomes. So this session is about 20-25 minutes, and we'll allow about 5-10 minutes towards the end for questions, and then we'll launch into the next session. So welcome everyone.
Kia ora everyone. Unless you think you're in the wrong room, what's happened is that I'm standing in for Derek Thompson, who had a slightly different title, but I am presenting on the outcomes framework. Derek puts his apologies in, he's not able to be here today. So thank you, Hannah, thank you for that. I'm not sure if which one I'm actually speaking to, but hopefully it's coming across quite clearly. Before starting, I just want to acknowledge the mana whenua of the local people, Ngāti Whātua here, and we've all been introduced to the kaumātua kuia this morning at the opening, and also heard some of our distinguished speakers talk. So I'll just check that everything's actually operational. So my goal is actually to just provide an overview of the purpose of this framework, and then Terry's actually going to talk about the actual baseline report. So the Ministry actually contracted KPMG to do an independent project for this outcomes framework. This framework's really owned by the sector. The Ministry is just really supporting the stakeholders in the sector across the country to actually carry it out. So I'll talk about some of the background to it, and then Terry will actually get into some more detail around the actual report. And then hopefully we'll have some time for open discussion and questions. Some of you no doubt were involved in this project, maybe on the advisory group. I can see some heads nodding. So if there's some really difficult questions, I'm going to look at you and ask you to address it. So just at a high level, the purpose of this framework or this project is to identify progress, our progress really as a country, in improving gambling-related outcomes for all New Zealanders, and in particular, and I'm not going to say problem gamblers given our Paparangi Reads discussion, people with gambling problems maybe, and those experiencing gambling-related harm. These outcomes actually direct connectly to the current strategic plan, national plan for preventing and minimising gambling harm. And the current plan identifies 11 objectives. So the idea behind the framework is to actually establish the extent to which we're all moving towards achieving these objectives. We're using an evidence-based approach to actually addressing how well we're actually progressing. And we're looking at this at a nationwide level, which is quite a task, quite a challenge. So I'm just going to briefly go through the 11 objectives. Some of you, I apologise, will probably know these objectives intimately. We're involved in the consultation process. The first one is a reduction in health inequalities related to problem gambling. And of course, many of us will know, and we heard this morning, that particular groups such as Māori and Pacific people have around 3 to 4 times the rate of non-Māori in terms of problem gambling. And of course, low socioeconomic groups too. This second objective directly links to the first one around inequalities, but it's given the treaty and the Crown's obligations under the treaty, it's about focusing on the extent to which our actions are supporting Māori whānau and family to achieve their health and well-being, particularly around the impacts of gambling through minimising the impacts. Objective 3 is about people's participation in decision making about local activities that prevent and minimise gambling harm in their communities. Now this links to the overall strategy approach, which is a public health approach, and that's here we're talking about community action, community empowerment, community involvement in decision making around gambling items. Objective 4, this is about policy at the national, regional, local level and how it actually prevents and minimises gambling harm. So an example of this might be looking at the extent to which local authority policies actually support the prevention and minimisation of gambling related harm. Objective 5, the extent to which the different stakeholders, government, industry, communities, family and whānau actually understand and acknowledge the range of harms from gambling. So the Ministry, and I'm directly involved in this as Senior Research Advisor, funds a research program that involves contracting independent suppliers to actually carry out large surveys that collects evidence on gambling participation, problem gambling prevalence and gambling related harms. So that information is actually available, it's published publicly, it's actually provided to the Minister, to policymakers throughout the whole country, so that actually this information can be used by people. It can be incorporated in public media campaigns, health promotion. Objective 6, this is focused on workforce development, and we heard again from Paparangi Reid this morning the importance of having the people there to actually deliver the services, to actually support the interventions. They have to be effective, they have to be culturally responsive, have to be appropriate. Objective 7, people have the life skills and the resilience to make healthy choices that prevent and minimise gambling related harm. So one way the Ministry is actually supporting this objective is ensuring that our large population surveys include question items around resilience and protective factors, so that that kind of information then can be used to inform our media campaigns and also our public health promotion campaigns too. And of course we contract a range of public health services too who use this information to develop their advice that they provide to clients, consumers. Objective 8, gambling environments are designed to prevent and minimise gambling harm. And so, for example, we're looking at gambling venues here, gambling machines. The Department of Internal Affairs plays a key role as policymaker and regulator in this area, looking at ensuring that host responsibility programs that industry are committed to are actually implemented, and they're implemented in an appropriate and effective manner. And the Ministry works with DIA to ensure there's appropriate compliance with these programs. Objective 9, problem gambling services effectively raise awareness about the range of harms from gambling that affect individuals, whānau and communities. So again, we use surveys to carry this out. We request that services provide satisfaction surveys for their clients going through their services in terms of their experience and the advice that they actually receive from these services. Almost there. Number 10, we're committed to providing accessible, responsive and effective interventions for preventing and minimising gambling harm. And access, we think about help seeking. Some of this was discussed in the think tank in the past few days, acknowledging that certain groups, Māori Pacific groups, particularly Pacific, have low access rates for services, about cultural responsivity and how important that is for engaging clients, whānau in the services, particularly those groups that are at much higher risk for gambling related harm and problem gambling. And again, that the interventions are effective, so it's prevention and treatment too, that it's evidence-based. As Paparangi Reid was talking about, science, it's high quality, it's evidence-based. And this directly links to the final objective, that we're committed to a program of research and evaluation. So we're using this evidence to inform what we're doing so that we know what we're doing is effective. So I'll just move on from that now. Just briefly, I'll just provide the whakapapa, the background to this framework. The idea came out of basically many people in this audience, no doubt, to develop a framework as part of the overall strategic process. And there were 65 submissions so this whole project goes back to 2009 and 2010, so there's a lot of interest in this. And a group, Quigley and Watts, analysed the submissions from the consultation process, and there was a strong core that there should be this kind of framework for assessing the extent to which we're actually achieving our objectives in the gambling sector. Just to point out here that prior to that, the Ministry contracted some research from Research New Zealand to look at how things are being done overseas, and a model provided by CUSEC and RIS 2004, who are actually associated with the World Bank, informed the development of this current framework. So now moving to the first baseline report, and I'm going to hand over to Terry now. And he's going to talk to you about some of the details. We'll just do a technological change now. I don't know if you actually need this now, because I think we're just using that.
Yeah, sure.
Is that okay?
Thank you, Ty. Kia ora, everyone. So, as Ty mentioned, the Ministry developed an outcomes framework, and Kake and Bowe was engaged in 2011 to measure that outcomes framework. So the idea of the framework is that a baseline report would be developed, which would give you, I guess, an idea of the current landscape of gambling in New Zealand. And then every year or so, there would be an annual report developed which measured progress against each of those indicators in the baseline. So the baseline report is that first step. That's the identifying the landscape. So there were 11 objectives within the strategic plan, and attached to each of those objectives were 4 to 7 indicators, which I guess it ties into an evidence-based approach. So we wanted to triangulate to see what results we could get for each one of those objectives. In total, there were 65 outcome indicators. Approximately 57 were measurable. So it's a pretty good go of it first up. So we used quantitative and qualitative data to assess the indicators, and a lot of it exists already. However, it did require several surveys to be developed, as well as templates and a couple of focus groups. So once we had developed and collected the data, I think a big thank you has to go out to the advisory group who patiently and diligently met with us over an 18-month period several times. And the role of the advisory group was to validate the data that we found and the findings that we had come to from that data. So I'd like to just quickly thank each member of this group. So firstly is Andrew Roger, who at the time was with Sky City. He was replaced by Setla Timopia around about halfway through the process. Big thank you to Bernie Smulders and Brenda McQuillan, who was our sector representative. Bruce Robertson, of course, from the gambling industry. Dennis McLeod, who unfortunately couldn't make it to one of our advisory group meetings. He passed, unfortunately. So he was replaced on the advisory group. Also, I'd like to thank John Wong, Kotoni Whao for his representation of the Pacific sector, Lady Lyndon Tonga, Lisa Campbell-Dimlu, and of course Dr. Maria Bellringer, Leona Christoforou, Sean Sullivan, Dr. Sean Sullivan, Tony Milne from PGF, Vanessa Sherlow from the gambling industry, and Zoe Hawke. Okay, so onto the key findings of the report. So I have to point out that each one of the numbers here associates to the objective, so 1 equals objective 1. The first major finding was that we found health inequalities are reducing, but inequalities remain for Māori and to a lesser extent the Pacific community. Secondly, gambling, we found that gambling negatively and inequitably impacts Māori, but support is available through services. Thirdly, people do participate in decision making. So we found that people do participate in decision making about local activities. However, while participation in decision making is good at a regional level, it is less effective at a local level outside of submissions to councils. And what we mean by that is that we found participation in gambling forums or community action groups was lower than what we expected. So the fourth point, healthy policy does exist at national, regional and local levels that prevents and minimises gambling harm. So we found that approximately 20 organisations collaborate with the Ministry of Health. On top of that, we found that approximately 86% of territorial authorities have some clause to, I guess, being actively aware of problem gambling in their communities within their policies. So we found that positive. So for objective 5, we found that people do understand and acknowledge the range of harms from gambling and that gambling causes. So government through to communities and individuals generally do understand and acknowledge the range of harms that gambling causes to families, individuals, whānaus. Point 6, there is a skilled workforce in the minimising gambling harm sector. So we found that 92% of practitioners have relevant qualifications. 70% of public health practitioners also have relevant qualifications. And in general, practitioners within the sector stay longer in this sector compared to others. So for objective 7, we weren't able to provide a full assessment. There were 2 reasons for that. Firstly, the National Gambling Study results weren't released at the time that we did this report. And secondly, the quality of data for one of the indicators we felt was a little bit low. So that meant that objective 7 could only be measured through 2 indicators. And at the time we felt that wasn't quite enough to draw a line in the sand, so to speak. So objective 8, the design of gambling environments. So we found that many of the elements that influence design of gambling environments in New Zealand are incorporated already into legislation. We also found that there was a positive, generally, working relationship between the gambling sector, the government departments, and providers. So that's something to, I guess, be positive about going forward. We also found that harm minimisation policies were generally in place and that there was a high degree of compliance with those requirements. However, if there was a breach, we found that it was generally to do with host responsibility. And I think importantly, only 3% of referrals to problem gambling services were made by the gambling industry, 68% of which was made by casinos. So for objective 9, problem gambling services we found do effectively raise awareness. So I think that the best example is Kiwi Lives. each of the programs in the Choice Not Chance program. I think they come across very well, and we found that in the reports. We also found that around about 15% of users of problem gambling services had been referred by community and health groups. So that was positive as well. For Objective 10, we found that interventions are mostly accessible and are responsive and moderately to highly effective. I think one of the great findings of the report was that service users had 97% of service users were highly satisfied with the service that they received. On top of that, we found that there was effective screening for other issues such as alcoholism. However, there are still some barriers to help seeking that came through in our research. The main one being that people wanted to overcome the problem by themselves. The second one was that people were shameful about going to a service. And lastly, there is an evidence base to underpin the problem gambling sector. So we found generally that research is strongly tied to the ministry's objectives, and that stakeholders feel that the ministry's management of the research program is continuing to improve. So I think they're the two findings to take away from Objective 11. So there were some interesting findings within the report that may be of interest given this conference. So whilst the baseline report found that internet gambling for money is not yet a major way for New Zealanders to participate in gambling, so in general it was 0.3% of the general population, we did find that spending on internet gambling marketing is high, or comparatively high. So internet gaming organisations such as Grand Reef spend the second highest amount on gambling marketing. That's $3 million per annum. So it's not as much as the NZ Lotteries Commission, but more than the TAB. So,
excuse me, how much of public health over the last 3 years has focused predominantly on a public health level against marketing by New Zealand Lotteries Commission? And how much research has been allocated by the Ministry of Health specifically looking at that question?
So that's probably outside of our remit to answer that. Yeah, and I think a lot of conversation went on about the policy mechanism around internet gambling.
So just on that point also, how can Grand Reef be allowed to spend $3 million on advertising in New Zealand television? Surely that's a breach of Section 16 of the Gambling Act.
So Grand Reef has a free internet site which you will go through to.
Spend $3 million on promoting that?
Yep. So once you're up through to that site, you can access a site which is a paying site. So that's not for money on a second site.
The courts have ruled that if the promotion doesn't involve wagering for money, it is outside that. Now I don't agree with that, and we have tested that.
I'm sure there will be much conversation about this in the years ahead. But one thing that did come through is that internet gaming and gaming for money using the internet and mobile phones was seen as the two most undesirable forms of gambling by communities and community decision makers. So I think people are aware of some of the things that are occurring in the industry, but it's not coming through in the statistics yet that people are actually participating in those areas. So after the baseline report, the first step is to develop an annual report. So as I mentioned earlier, the idea behind the annual report is to measure trends against those baseline indicators. So the Ministry is in the process of commissioning the annual report, and the results of the first annual report are expected later in the year. If you'd like more information on the outcomes framework, I strongly advise you to go through to the Ministry's website and just type in the search term outcomes framework. It's a heavy document, it's almost 300 pages, but I think if you use the summary up front and then dive into the indicators that you're interested in or that are relevant to you, then do so, because it does contain good information.
Those findings you just outlined, are they also on that, those findings you just referred to, are they up front in that document?
Yes, they are. Yeah.
Thank you. So we've probably got time for one, possibly two questions.
Yes, do you have any data on how many people who are estimated to be problem gamblers actually seek treatment? And secondly, do you have any data on how many of those who seek treatment are problem gambling free 2 years later? Or any other measure of success?
Sure, so that's a good question, and I think the Ministry's click data does answer part of that. We assessed whether we looked at more the barriers to presentation. So I think, as I mentioned earlier, that came through with quite a large amount of people, around about 50%, saying that they didn't go help seeking because they thought they could solve the issue themselves, and that's probably the best way that we can approach that question.
I mean, this is what's published. I mean, there's a big report coming out in the next few months that goes more directly to your question. But the last New Zealand Health Survey, which is on the Ministry's website, does look at, I think you're talking about the gap between what the epidemiological data, large populations data, is saying is the prevalence of problem gambling, and then actually who actually presents to services. And I think from memory it's about between 10 and 15% of the actual number. So it's a very small number, quite a small proportion actually present.
Very high number by international standards.
Okay. It's not good enough for us. Are we over time?
Okay, so we haven't got time for any more questions, but Ty is going to be here for the next couple of days and he's very approachable, so if you have got any questions, then please feel free to come and ask him. And thank you again to Ty and Terry for making 57 measurable outcomes digestible to us.
Thank you.